Greetings. We welcome you to this educational video. My name is Dr. Jacob Curtis. I'm a physician at Grand Peaks Medical. My background is in family medicine with an extra area of emphasis in obstetrics and emergency medicine. After the completion of that training, I went on to do an additional obstetrics training, and so much of my work is providing women's health and OB care and also taking care of newborns, as well as general womb-to-tomb family medicine. I've been a physician for 15 years. I've been practicing in Idaho for 12 years and at Grand Peaks for the last 4. We've put these educational videos to help you as you're striving to find good resources of healthcare information that can help to guide you with questions you might have, and many of you may be pregnant this time, and this information is for you. So what we're going to do over the next few moments, this should be about 10 minutes in length, is go over the current guidelines in prenatal care. And we break up these educational videos into 3 segments: the first, second, third trimester. Before we begin, it is important that we give a medical legal disclaimer that the advice given in these videos is not to replace that which is given to you by your healthcare provider, but rather to be used to supplement or with. If you're having concerning symptoms, we invite you to talk to your healthcare provider. If you're having severe symptoms, please call 911 or go to your nearest emergency room. I think this is an important statement. This comes from a time-honored obstetrics textbook that's used by OBGYNs throughout the world and have used it for decades. It's from Williams' Textbook of Obstetrics, and it summarizes well the purpose of prenatal care. The quote is this: "The objective of prenatal care is to ensure that every pregnancy culminates in the delivery of a healthy baby without impairing the health of the mother." That's our goal. What are the current guidelines in prenatal care? This is a summary slide of what we're going to capture or cover in the next 3 educational videos. We're going to talk about preconceptual counseling. We discuss the importance of prenatal vitamins, specifically something containing folic acid, usually 0.4 milligrams daily, higher if there's other reasons for concern. Routine prenatal care, as a general rule, is started by 10 weeks and results in a doctor's visit every 4 weeks into the 3rd trimester. It ends up being about 12 visits. Of course, individuals with more high-risk conditions will need to be seen more often and or see other specialists as well. We'll talk about antenatal screening. We'll talk about pros and cons and limitations of prenatal ultrasounds. In the 2nd trimester educational video, we'll talk about reducing preterm labor, screening for diabetes, as well as high blood pressure, screening for other infectious diseases. GBS stands for Group B strep screening. And then in the 3rd trimester educational video, we'll talk about pros and cons of inductions when they're appropriate, how we're avoiding episiotomies nowadays, the importance of delayed cord clamping, pain control options, how we go to great lengths to minimize cesarean sections and when they are indicated, and pros and cons, the importance of breastfeeding, and then the importance of a postpartum examination. Preconceptual counseling is an important part of prenatal care, oftentimes overlooked. It's especially important for individuals with chronic medical problems who take chronic diseases or have concerning past medical history that should be addressed before conception to optimize the health of the pregnancy. This is a time where you can visit with your doctor, review medications that could have some safety questions during pregnancy, make adjustments and plans. Perhaps one of the more important aspects of preconceptual counseling is studying prenatal vitamins. The recommendations are actually to take 3 months before conception, if you're able, specifically with something containing folate or folic acid. 0.4 milligrams daily has been shown to help decrease the incidence of neural tube defects such as spina bifida. If you have certain high-risk conditions, things such as rheumatoid arthritis, or medications that could suppress your body's ability to absorb folate, the recommendations will be for a higher amount. Another important aspect of a preconceptual visit, and if it doesn't happen preconceptually, it's not a huge deal for an otherwise healthy individual. We do these things at your first prenatal visit, usually around 10 weeks. A physical exam, kind of head-to-toe checkup to make sure there aren't any concerns. We use these also as an opportunity for education. Most people aren't looking forward to pap smears, but it is an important part of health. They're not as often as they once were, but that helps to screen for cervical cancer. Laboratory assessment and screening. I believe my next slide talks about this in more detail, but let me just elaborate. This is an opportunity to check a patient's blood type to make sure there aren't any concerns with incompatibilities with your future baby. It also gives us a chance to screen for certain infectious diseases that, although fairly less common in the population, still can have negative effects if not identified early. Things like HIV, hepatitis, to make sure there's never exposure there, as well as other infectious diseases. It's also an opportunity to make sure a patient's not anemic, so we can correct that. We also look for asymptomatic urinary tract infections, asymptomatic meaning patients not having symptoms at the time. It's also a great opportunity, again, either preconceptually at that first visit, to review medications that you're on, both that which is prescribed as well as over the counter to ensure their safety and talk about proper use during pregnancy. And it's also a great opportunity to identify potentially teratogenic substances, alcohol, tobacco, even vaping, marijuana use, other recreational drugs that could have harmful effects on your pregnancy. Patient education, this is a huge part of the first prenatal visit. We usually spend about 10 minutes one-on-one with our patients reviewing these aspects. Some of you might be watching this educational video in anticipation of that or as part of that. Anticipated course of prenatal care, that's referring to the frequency of visits. For an otherwise uncomplicated pregnancy, usually it comes to be about 12 to 13 visits. Starting that first prenatal appointment around 10 weeks is recommended. Earlier, if there's concerns such as heavy bleeding or significant pain or uncontrolled nausea and vomiting, we usually like to see our patients earlier to assess and help address those symptoms. But it's usually once a month, every 4 weeks, up until about 28 weeks as you start the third trimester. We then like to see you every 2 weeks into about 36 weeks, and then we start seeing you weekly thereafterwards, with most delivering somewhere in the neighborhood of 38 to 41 weeks. Nutrition and weight gain counseling. That's a question I get asked often in the office. How much weight should I gain, doctor? The general answer is around 30 pounds. Now, we're all born on this earth with different shapes and sizes. It's what makes the world so great. Some of us have a more predisposition towards one shape or size over another. So if somebody has a BMI that's significantly higher, perhaps your weight gain will be less. I've even had some patients get in the best shape of their life during their pregnancy and even lose weight, and that can be okay depending on where you're starting. I have other individuals who may start at a lower BMI and they may gain significantly more. What I always encourage my patients is to not live on the scale. Don't focus on that number. Don't let it define your self-worth, but use it as an objective marker to kind of help gauge. Try and help make healthy choices. Try not to drink your calories, avoiding sodas, juices, even milk in excess can add additional calories, contribute to less healthy weight gain. Often overlooked for my patients, they get so busy, especially with small children, taking care of others, that they might neglect their own needs. Small and frequent meals, especially the frequent meals, but smaller portions. And part of the zest and enjoyment of life is enjoying occasional treats out there, but just making sure that's not a mainstay of our diet, that it truly is on rare occasions and we're not consuming those in excess. Those things that we got away with in our teenage years usually catch up to us as we get older. Exercise is such an important part of our health, and it's no different during pregnancy. Please don't allow yourself to have mom guilt if you're not exercising as much in that first trimester when you're not feeling as good. But as you start to feel better, individuals who exercise throughout their pregnancy have babies that are smaller but are healthier. I've shared with many of my patients a story I had when I was doing my obstetrics training out in the Midwest. She was a graduate student. She used to run marathons, and she ran 5 miles on the day of her delivery. I don't share that so women hate her, but rather the result was she had a baby that was smaller but super healthy. And so if I were going to push a baby out, the idea of a smaller baby is going to cause less likelihood of shoulders getting stuck, as well as perineal or vaginal trauma. So definitely encourage exercise. That could be something as simple as walking 30 minutes, 3 to 5 days a week, but I definitely encourage that. Oftentimes I get asked, is intimacy okay in pregnancy? It is, as long as you don't have a medical condition that would prevent that or discourage that. And really the biggest one being a condition called a placenta previa, which may be diagnosed at 20 weeks. That's when the placenta is over the cervical opening. But most individuals, as long as it doesn't cause pain, discomfort, it is safe. Some women will call alarmed and concerned that they may have some spotting after intimacy or intercourse. And that's expected just because the cervix has a more robust blood supply. Environmental work hazards, it's probably not as pronounced as once thought to be, but if you are employed working around dangerous chemicals, consult your MSDS, material safety data sheet, talk to your supervisor so that precautions can make. As far as the lifting, that's kind of been passed on by tradition. There's not a strict study that shows that women can't lift more than 20 pounds. We often say that just because they're more likely to get injury as their body is changing. And so whatever you're capable of doing, as long as you do it safely and as long as it's not kind of causing discomfort. We live in a time that many people are traveling during pregnancy, and that's okay up until about 35 to 36 weeks, unless you have a medical condition that prevents that. We do recommend stretching your legs every couple hours to prevent blood clots if traveling in a car or plane for more than 2 hours. Avoidance of recreational substances. When is an ultrasound necessary? An ultrasound is helpful if we're having concerns and we have not yet confirmed an intrauterine pregnancy, a pain in either quadrants, even though a tubal pregnancy, also known as ectopic, is rare. We want to make sure that that's not causing lower quadrant pain if you don't have a confirmed pregnancy. It also helps us to evaluate if we're having significant bleeding to rule out or evaluate for possible miscarriage, although unfortunately we don't have a lot to stop that early on in the first trimester. Domestic violence, it's important to realize that there's a lot of stress and changes that affect couples and relationships, and it's important to talk to your healthcare provider if you're feeling unsafe. We're not going to call the police necessarily without consulting you and talking to you, but we just want to help to make sure you're safe and get the resources for you and your partner to have a healthy pregnancy. Please wear your seatbelts. As your uterus becomes more gravid, you put the seatbelt below the dome of the uterus. And there's also childbirth classes, sometimes offered through doctors' offices and also through your local hospitals, that can be started early and especially by around 32, 34 weeks. This slide, antenatal serum screening, just educates us that there are some optional blood tests available. Between 15 and 18 weeks, historically, there's a blood test known as a quad screen. It looks for certain proteins that, if elevated, could suggest increased risk for having a child with Down syndrome or spina bifida. It doesn't guarantee it, it doesn't negate it. It's just something that helps to quantify. That is available. And in recent years, I'm not endorsing this product over others. It is proprietary. I have no stock in the company, but the Maternity 21 Plus test looks specifically at chromosomes. It looks for non-disjunction, sex chromosome abnormalities, things such as Down syndrome, which is trisomy 21, something called trisomy 18 and 13 as well. It also looks to genetic sequence abnormalities, what we call microdeletions, things like Cry-Duchenne and DiGeorge syndrome. Most insurances aren't going to cover it because it is so expensive unless you have a personal or family history of a specific chromosome abnormality or other risk factors, but you're always able to reach out and check with them and your insurance to see if it's covered. Ultrasounds aren't required, but an often present part of prenatal care. In our office, we usually do those at the first OB appointment, confirm the pregnancy, also make sure the dates of the baby is consistent with that predicted by the period. And then oftentimes we like to do them around 20, 21 weeks as well. I have a slide that talks about that. Less common today are invasive procedures, amniocentesis, where a needle is placed inside the uterus and fluid is collected to look for certain abnormalities, or coronary villi sampling, just simply because those are associated with some increased risk, but they are available too. Prenatal ultrasounds can be quite helpful. The most routine ultrasound often occurs in many offices around 20, 21 weeks, sometimes sooner. Not everybody, but most are excited to identify the gender, which is exciting, but it's also super important to help us to confirm that the growth has been appropriate, consistent with our predicted due date, helps us to look at organ structures, heart, brain, internal abdominal organs, helps us to look at the amniotic fluid level, cervical length, as well as where the placenta is at to make sure there aren't any concerns there. This is an important slide that I always like to kind of conclude with. It states this: 44% of parents feel prepared for parenthood before their first baby is born, which means less than half. Once their baby is here, their confidence drops to 15%. The reason I share that, and this is old, but it's been repeated in recent years too, this is 20 years ago, it's normal to feel overwhelmed and underprepared and wonder if you're going to be a great mom or dad. You're doing much better than you realize. Give yourself some props. We're here to help you out through that journey, but you're going to be great, and wish you well with your prenatal care. Thank you for participating.